I'm Natalie Baiamonte with Maryville University. I'm a family nurse practitioner student, and I'm taking the advanced health assessment. This is Christopher Baiamonte. He's going to be my patient so that I can do my head-to-toe assessment. Prior to coming into the room, we checked his vital signs, his height, and his weight via the Snellen chart. We checked the optic nerve, which is cranial nerve number 2. And we also checked his near vision. He emptied his bladder and he put on a gown, and we're ready to begin. We're going to start off with the inspection of the head. It's normal cephalic. He does have, his hair is evenly distributed around the sides, the back, but he's got some male pattern baldness going on up here. And the texture of his hair is soft. He's got a little bit of wave to it. I'm going to palpate his skull to make sure that he didn't have any, it's not tender, or there's no bumps or lumps or bruising. Did you feel any pain?
Nope.
I'm going to examine his facial bones to make sure that they're intact. And they are intact. Okay. The next thing you want to do is check the symmetry of his eyes and his ears, and they are symmetrical. And they're placed, evenly on both sides. We're going to assess the cranial nerve number 7. So I'm going to ask him to raise his eyebrows and close his eyes really tight. And then I'd like for you to puff out your cheeks and smile, and puff them out. Yeah, smile real big, puff them out. Now smile real big. Okay? And that's good. So the next thing that we're going to do is I need you to stick your tongue out and move it from side to side. Very good. Okay, and I'm going to palpate your sinuses and your tempo. Okay, what I want you to do, I'm going to check your temporomandibular jaw. I'd like for you to open it and close. And I didn't feel any clicks or grinding or anything like that. Okay, so I'm going to palpate your sinuses lightly. Any pain or pressure?
No.
Okay, there's no pain or pressure in the sinuses. And the next thing we're going to do is I'm going to go to his eyes. And I'm going to check his eyebrows. They're even on both sides. The hair is evenly distributed. He's got eyelashes. There's no scaliness or no drainage. I'm going to check his lacrimal apparatus. And there's no puffiness or swelling with that. I'm going to check cranial nerves 3, 4, and 6. I'm going to look at his pupillary response. Just look straight ahead. Direct and consensual. And then over here, direct and consensual. Okay? And I'm going to look at the sclera. It's white on both sides, both eyes. The sclera is white. The conjunctiva is pink and moist. And what I want you to do now, Mr. Baiamonte, is take one hand and cover one eye. And look at me. Don't push. Just cover lightly. Okay? And then take your other hand and cover this eye. And there's no nystagmus or any involuntary movements there. I'm going to check his extraocular movement. And what I want you to do, Mr. Baiamonte, is watch my pen light as I move it. Don't move your head. And the other eye, the other side. Very good. Extraocular movement is intact. Next, we're going to go to his ears. And you can see the symmetry of the ears. They're one on each side of his head. They are, there's no deformities on inspection, no drainage, no, well, he's got some hair on his ear back here. I'm going to palpate his auricle and his earlobe. I don't feel any nodules, and it wasn't painful, was it? Okay. Now I'm going to look at the ear canal. I'm going to check to make sure that the tympanic membrane is intact. There's no bulging. The tympanic membrane is intact. I can see my landmarks. The ear canal has some cerumen in there, but not much. I'm going to check this ear. The ear canal is clear of cerumen. The tympanic membrane is dry and is not bulging. There's no redness, and I can see the landmarks on there. Now we're going to test the vestibulocochlear nerve, which is cranial nerve number 8. And what I'm going to do is I'm going to hit the tuning fork, and I'm going to place it on top of your head. And you're going to tell me if you can hear the sound in both ears. Okay?
Yep.
Okay. And the next thing I'm going to do is I'm going to hit it again. And I'm going to place it behind your ear. And you're going to tell me when the sound goes away. And then I'm going to place it beside your ear. And you're going to tell me when the sound goes away. You ready?
Okay.
Tell me when it's going.
Okay.
Okay, very good. Supposed to be twice as long. This is to check the air conduction and the bone conduction. Tell me when it goes away.
Okay. Okay.
Okay. Yes, sir. Now I'm going to do the whisper test. I'm going to say a word, and then you're going to repeat it. Orange.
Orange.
Very good. We're going to do it again.
Purple.
Okay. Okay. Cranial nerve number 8 is intact. And now we're going to move on to the eyes. No, we already did the eyes. We're going to move to the nose. I'm sorry. On inspection, the nose is a little deviated to the right. And the cartilage feels normal. There's no lumps or bumps noted. It's not painful.
No.
Okay. And I'm going to look inside his nose and look at the turbinates. Look for any polyps or anything. There's no polyps. The septum is deviated to the right, but both nares are clear and the turbinates are pink and moist. And next thing I'm going to do is check cranial nerve number 1, which is the olfactory lobe, or olfactory nerve. Can you close your eyes and cover one nostril and tell me what you smell?
Alcohol.
Okay, and cover the close. Keep your eyes closed. Do the other one. Tell me what you smell.
Alcohol.
Okay, very good. Okay, we're gonna move to the mouth. His lips are pink and moist. There's no cyanosis. We're going to check his gag reflex. The uvula is midline. Tonsils are grade 1. The palate, say ah. The soft palate rises equally. And the hard palate intact. Mucous membranes are pink and moist. The teeth are all there. There's none missing. And can you put the tongue to the roof of your mouth? The floor of the mouth is moist, and the gums are moist, pink and moist. Okay, I'm going to check your trachea. Trachea is midline on the neck, and the thyroid, I'm palpating the thyroid, but I can't feel it. There's no nodules or anything, granulation like that. The neck is, there's no extra, jugular vein distension, and there's no extra folds. We're going to check the spinal accessory nerve, number 11. If you could shrug your shoulders for me, please. And then against my hand. Very good. And if you could put your right ear to your right shoulder, and your left ear to your left shoulder, and look up and down, and then push against my hand. Very good. Push against my hand. Very good. Okay. Next thing we're going to do is we're going to check your upper extremities. We're going to inspect and palpate. We're going to inspect. The skin is warm and dry and pink, and the hair is evenly distributed on both sides. He's got good muscle tone. He's got good range of motion in his shoulders, and his elbow, his wrist. Move your wrist around and around. Can you do the other wrist around and around? And bend your elbow, raise your arm. Very good. Now, his fingers have good range of motion. And there's no cyanosis or clubbing of the fingernails on either side. And he's got brisk capillary refill. So the next thing we're going to do is I need to check your brachial pulses. Your radial pulses, those are equal bilaterally also. Now we're going to move on to the back and the posterior chest. On inspection, the back and the posterior chest, the hair is evenly distributed, and he does have some freckling and a few moles. They don't appear to be abnormal. We're going to check his. I'm going to palpate his expansion. So take a deep breath for me. I place my thumbs on either side of the spinal column, and the palm of my hand on the 12th rib, and do it again, and my hands go apart. Okay, I'm going to palpate and check for any nodules. I'm gonna or lumps or bumps, and I'm going to check for tactile fremitus. If you could say 99.
99.
99,
99,
and 99.
99,
I'm going to look at the costal, I'm going to percuss the costal vertebral margin. Tell me if you feel any pain.
no,
Okay, very good. Now I'm going to do the costal vertebral margin and take a deep breath for me. Start at the subscapular area and palpate. Hold the breath. I'm listening for a change in the tone. And I feel it there. Go ahead and breathe. I'm going to mark it with my pen. Okay, just breathe. A few deep breaths and relax. Okay. And then now I want you to take a deep breath and blow it out. And I'm going to start at that and hold it. I'm going to start at that point and I'm going to go up and check for a sound change. Okay, the sound change. Go ahead and breathe. And then I'm going to measure that. And it should be less than 5 centimeters. It is right at 3 centimeters. And I would do that for the other side also. Okay, now I'm going to auscultate the lungs. Take a deep breath. Hang on a second. Deep breath. Okay, he's got his bilateral breath sounds are clear to auscultation. I don't hear any heaving or thrills or pulsations. The respirations are even unlabored. And now I'm going to check the front chest, anterior chest, for symmetry. It's breathing normal. There's no retractions or anything. He's breathing, his chest is rising and falling equally, bilaterally. And I'm going to go ahead and listen to his breath sounds. Can you raise your hands over here? I'm going to listen to the lateral chest wall. Very good. So now I'm going to palpate for tactile primitus. Say 99.
99,
99.
99,
99.
99,
99.
99,
Very good. Okay, I'm going to percuss for dullness. Resonance. I'm going to palpate your lateral chest. Now I'm going to listen to your heart sounds, and I'm going to be listening to your aorta right here. Pulmonic valve. Herb's point. Tricuspid. And mitral. Okay, I'm going to listen to your apical pulse. S1 and S2 heard, no murmurs, no gallops. Okay, you can lay down for me. I'm going to check your PMI, aortic impulse. Okay, and I'm going to examine your abdomen. He's got, on inspection, he's got a lot of hair, evenly distributed on both sides. I'm going to check the contour. I don't see any hills and valleys and things like that. It looks pretty symmetrical. I'm going to auscultate your vowel sounds, starting with the right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Okay, I'm going to do some light palpation just to make sure that I don't feel any. Nice and soft. Okay, and I'm going to palpate. Let me go over here on this side. Palpate for the liver border. I want you to take a deep breath and blow it out. That is right there. Okay, and then the same thing for on the spleen side. Deep breath and blow it out. Cannot palpate the spleen. I'm going to try to isolate this kidney over here. I can isolate the kidney on this side. Let me go to this side. I can isolate, there's that kidney right there. Okay, and I'm going to go on the other side and I'm going to percuss for the liver border. Okay, so what I'm going to do is I want you to take a deep breath and hold it. Okay, let it out. Okay, and then I'm going to mark that, and then I'm going to start there. I want you to inhale and blow it all the way out and hold it. There it is. I want to measure that. That's about 2.5 to 3 centimeters, which is normal. Now I'm going to listen to your abdominal aorta. Your left renal artery. Your right renal artery. Your right iliac artery. Your left iliac artery. your left femoral artery. And your right femoral artery. Okay. You want to set up now? Let me help you. Okay, I need to percuss your costal reticular margins. Did that hurt?
No.
I already did that. Just checking. Okay, now we're going to do his lower extremities. And you can, on inspection, the hair is evenly distributed. Looks like he's got the same muscle mass on both sides. His skin is warm and dry to touch on both sides. There's no edema in his feet. I'm going to palpate the dorsalis pedis. They're equal bilaterally. The posttibial, they're equal bilaterally. Popliteal, equal bilaterally. Okay, and so now we're going to test his reflexes. And so I'm going to do the brachial, okay, and the radial. Come over here and do the brachial, the radial, and then we're going to do his knees. Okay, and then we're going to do the Achilles tendon. Okay, there we go. And if you can stand up, please. And check his cervical and his lumbar and thoracic spine. Any pain?
No.
Can you bend over and touch your toes? Okay, and roll up. And I'm checking the spine. I don't see any curvatures, or are there any bulging disc or any lumps, bumps, or tender spots. Okay. And Mr. Baiamonte, that concludes our head to toe assessment. You should come back every year for a physical examination.
Thank you.
Thank you.